Good morning, I'm Adam Sexton. Granite Staters are either very good at social distancing or lucky or a combination of both as New Hampshire continues to ride out relatively lower rates of COVID-19 community transmission than a large number of states. Here this morning to provide a window into the state's response is HHS Commissioner Lori Shibinette. Commissioner, thanks for joining us.
Thank you.
So what has New Hampshire done differently from these other states like Arizona, where they're seeing a spike in cases and right now we are relatively low?
So, what I really can talk about is what we've done right, which is really, really important, right? Is, our contact tracing policy was probably one of the best things we did right from the get-go. We never stopped doing contact tracing, and it's something that other states became overwhelmed when they started to see the rise in numbers. But very early on, we hired and we procured enough people that when our numbers started to go up, we were able to maintain the contact tracing program that we started right from the very beginning. And what that really does is, it stops the spread from every carrier. So if you have one person that tests positive and without the contact tracing, they perhaps spread it to 10 people, also called the R0, right? 10 people or 15 people. So as we're able to kind of branch out from that individual positive and stop the spread by doing quarantine and isolation, you essentially, stop that virus in the tracks for those people. So being able to continue to do contact tracing was probably one of the best things we did. The other things, New Hampshire citizens are great at social distancing and wearing masks every time I'm out. So grocery store shopping, I'm watching people all around me in masks. I toured some of the homeless encampments yesterday. The residents in the homeless encampments, some of them were wearing masks. Everybody that was touring with me to talk to some of our unsheltered citizens wearing masks. Every meeting I go to wearing masks. So those are some of the things that people in New Hampshire do really, really well, and we can attribute some of our success to those actions.
I couldn't help but notice in the latest round of guidance on amusement parks, there's a limit of 25% capacity. Certainly, schools are not amusement parks. I'm sure a lot of kids wish they were, but there are large gathering venues. I know there are a lot of plans in the mix in terms of how to bring kids and teachers back into the classroom, and everybody wants to get back there. But is it possible we'll see some kind of limit on capacity? Could there be a staggered schedule or sort of a hybrid remote and in-classroom learning? Is that on the table?
So, I think the committee and Commissioner Edelblue and the whole group of people that are looking at education, including public health, put all of those options on the table. And I know they've talked about staggered school schedules and having certain students there at certain times, maybe half day, and a different group there in the afternoon. What I think is really important for the public to know is that what is your comfort level, right? If your child has an underlying condition, or if you have an underlying condition, or someone in your family has an underlying condition, or you're just not comfortable to send your kid back to school this coming fall, depending on what our rates look like, a lot can change in 2 months, as we know. Making sure that you have an option to do homeschooling for part of the year, or do remote learning for part of the year. I think every family really needs to look at what the risk and benefit is for them. But I do expect that both public and private school will have a degree of lowering the class numbers at any given time, whether that's through staggered scheduling, either per day or during the day. Mask wearing, not always going to be reliable amongst especially small kids. So can't really rely on that great. Can't rely on them to always do 6-foot social distancing. But I'm sure that the task force that's looking at that, they're going to really look at what's realistic, right? You can tell kindergartners or first graders that to wear masks and social distances, that's not realistic. We know that's not going to happen. So what are the other things we're putting in place to make sure that these kids stay safe and are not able to transmit the virus or easily transmit the virus if someone comes up positive?
Commissioner, how stringent will the state have to be regarding school-related outbreaks if and when they do occur? Is it going to be one of these sort of close the classroom situation, close the school, or close the district?
It really depends on the investigation. So there is, you're right. So when we do our case investigation, it's going to be, where was that student? What classroom were they in? Did they participate in gym activities? Did they go to music class? Did they go to art class? Did they intermingle with other students? Were they in the cafeteria for lunch? All of those things. And I think that case by case, we're going to make a decision on, do we close the classroom for a day and do a full sanitation of the classroom? Do we have to close the school for a day? It really is going to be every individual case investigation. And really, that's not much different than what we do right now when we have a positive case come back from maybe a workplace. We have to make decisions on whether we're closing one area of a workplace, the entire workplace, or even go beyond that. So it really is going to depend on the case investigation.
The other day you were talking about a contact tracing model in a national report that assumed that there were 10 close contacts for every one case of COVID-19, and you said that actually didn't fit New Hampshire, that here the average number of close contacts for someone who contracts COVID-19 is 3. Are we really that isolated here in New Hampshire that we only have 3 close contacts per person, or are those numbers warped a little bit because there are so many cases in long-term care and those people are already kind of locked down in their rooms a little bit?
There's a lot of reasons for that. The long-term care is one of them. We've been out, we've not been engaged completely in the workplace for a good amount of our citizens. We've been socially distancing. Our restaurants have been closed. All of the things that we typically do have been closed, and we are rural. So there are multiple reasons why our close contacts are only at 3. We've done a very good job of messaging that if you have any illness at all, if you feel that at least have a very low threshold for feeling sick, that's what we've told people. And if you feel that way, stay home, don't go out. And I think the New Hampshire citizens have done a good job on that. But when we look at our case investigations, we're looking at 3. And when you look at that report and you look at the numbers that I report, right, I would say between 125 and 135, the state has in public health doing contact tracing. The other component that those reports, or when we report here in New Hampshire, that we don't take into the account, that Manchester Health Department and Nashua Health Department have their own contact tracing teams. So public health in the state public health department does the balance of the state. And we do help Manchester and Nashua at times when their caseloads get high. But in addition to the 125 to 135 contact tracers, we have an entire team at Manchester Public Health that does a great job, and an entire team at Nashua Public Health that does a great job. So that's in addition to those numbers. So
long-term care visitation starts this weekend. That's your background. You came out of the nursing home long-term care facility management. How hard is it going to be to maintain that physical distance for people, the no touching rule essentially? It's got to be agonizing, I bet.
I think that is probably the hardest part of the nursing home visitation guidance, right? When we were reviewing it, and all I can envision is family members coming into the kind of the front porch of the facility or a designated area and just wanting to give their loved one a hug. And I can see it, right? I spent 20 years in long-term care, and putting that in there was really, really tough. But it's always a balance between the psychosocial well-being and the physical well-being of the resident. And just to note, there are several nursing homes right now in the state that began their visitation program the day that we put out the guidance. I saw on Facebook yesterday, Merrimack County, where I spent 16 years, already had their first day of visitation, and it went great. And so it makes me very, very proud to see nursing homes just stepping up and understanding how important that psychosocial contact is for their residents.
You mentioned the balance here between the risk of transmission and the mental health, the wellness aspect. What's going to happen when the weather turns back to cold and you can't do the outdoor aspect of this anymore? Do the visitation, does that have to stop?
I think that we have to look at what happens over the next couple months. We're unsure. We and I've said this right from the very beginning, is we know so much more now than what we did 3 months ago. And I think in September, October, we're going to know so much more then than what we know now. And we need to really look at what we learn over the next couple months and figure out what is the best way to take care of the residents in the nursing homes, just our seniors in our community. You know, we talk a lot about the residents in our nursing home and their psychosocial well-being, but let's not forget that we have seniors in the community that have been socially isolating, away from their kids, away from their family, and they also need that psychosocial interaction, and they also can't get it when they're social isolating. So we will have to look at the next couple of months and you know, where this virus goes. But what I can tell you is we're in much better shape today than we were 2 months ago. We're going to be in much better shape in September than we are now when it comes to system development, testing, and all of those things. So we'll be in a better place to make better decisions.
All right, Commissioner Lori Shibinette from HHS, thanks so much for joining us on Close Up. We appreciate your time.
Thank you.